I'm Sarah, the nurse practitioner here with Elite Living, and I'm going to be showing you how to administer medication. First off, wash your hands, which I already did prior, and then you're going to apply or put on your gloves. We're going to start here with the vitamin D injection. This is going to be intramuscular. Go ahead and remove the vial. We have alcohol. We have two different needles here. We're using one to draw up the medication, and then we're going to take that off, put on the other needle to administer the medication. Go ahead and get an alcohol pad. You're going to clean off the top of the vial. Okay, you're going to take your syringe, and you're going to make sure that you take the bigger needle to draw up the syringe. So we have a 21 gauge and a 23 gauge. Just remember that the smaller number is actually the bigger gauge. Okay, so I'm going to use the 21 gauge to draw up the medication. And apply that. We've already cleaned off the vial. I like to just stabilize the vial on the table and go ahead and inject downward. Be careful not to inject yourself just yet. Okay, we can go ahead and start drawing out the medication. If you get any bubbles, I will show you how to clear those bubbles. This actually looks pretty clear, but if you do get any bubbles, you can just tap it, and you'll see that the bubbles will go to the top. Be careful when you go to recap the needle, because now you're going to change it, okay? Remove the one that you drew up with, and now apply this needle that you'll be drawing, that you'll be injecting with. Here we call it priming the needle, just making sure that the medication comes all the way up so you're not injecting an air bubble into yourself. Okay, Ian, ready for your IM injection? Okay, so we're gonna put this into his deltoid, which is right here, okay? You go ahead and take another alcohol pad so that it's nice and sterile. I got the needle here, the bevel is up. You can grab the muscle to put in. If you're doing it yourself, you might not be able to do that, but if you're doing it for someone, you can grab the muscle and go ahead and just inject. Is that okay? Mm-hmm. All right. So Ian is a muscular guy, so injecting 1 cc into his deltoid is fine. If it's a thin person, got it, you may want to put half a cc in one syringe, separate it, or just find a very muscular area, not a thin area to inject. He's all done. If I had a Band-Aid here, I'd put a Band-Aid for him. How was that, Ian?
It's all good.
Okay.